Welcome to today's lecture on esophageal diverticula. In this comprehensive script, we will delve into the definition, types, etiology, clinical presentation, diagnosis, and treatment of various esophageal diverticula. We will also explore the complications associated with these diverticula, radiographic and endoscopic evaluation techniques, manometric assessment, surgical management, functional assessment, atypical presentations, and emerging therapies. By the end of this lecture, you will have a thorough understanding of esophageal diverticula and its management. Esophageal diverticula are pouch-like outpouchings of the esophageal wall. There are three main types: Zenker's, traction, and EPIPHRENIC diverticulum. Etiology involves structural and functional abnormalities, leading to symptoms such as dysphagia, regurgitation, and respiratory complications. Zenker's diverticulum is a common form of esophageal diverticula affecting older individuals. Its development involves an outpouching of the esophageal wall due to increased pressure and weakened muscles. It presents with symptoms like dysphagia, regurgitation, halitosis, cough, and respiratory infections. Diagnosis involves clinical suspicion, barium swallow radiography, and endoscopy. Treatment can include lifestyle changes or surgery. Traction diverticulum results from fibrosis and inflammation surrounding the esophagus, leading to traction on the esophageal wall and subsequent outpouching. This type of diverticulum is commonly associated with long-standing inflammatory conditions, such as tuberculosis or histoplasmosis. Clinical features may include dysphagia, chronic cough, recurrent pulmonary infections, and weight loss. Diagnosis is established through a combination of clinical suspicion, radiographic evaluation, endoscopy, and occasionally, biopsy. Management of traction diverticulum may involve addressing the underlying inflammatory condition and providing supportive care. In some cases, surgical intervention might be necessary. Epiphrenic diverticulum is a condition in which a pouch forms in the lower part of the esophagus due to increased pressure. It is often seen in patients with motility disorders. Symptoms include difficulty swallowing, chest pain, heartburn, and weight loss. Diagnosis involves imaging tests, manometry, and endoscopy. Treatment options depend on the underlying disorder and may involve lifestyle changes, medications, or surgery. Esophageal diverticula can lead to various complications. Strictures may occur at the site of the diverticulum due to chronic inflammation or fibrosis. Diverticulitis can result from food impaction or secondary infection within the diverticulum. Aspiration pneumonia is a significant concern in patients with esophageal diverticula due to recurrent regurgitation and risk of aspiration. Furthermore, rare cases of diverticular malignancies have been reported, emphasizing the importance of long-term monitoring and surveillance in these patients. Radiographic evaluation using a barium swallow technique is an essential modality for diagnosing esophageal diverticula. Barium swallow demonstrates the characteristic outpouchings and identifies the size and location of the diverticula accurately. It also helps differentiate diverticula from other esophageal lesions, such as tumors or strictures. Endoscopic evaluation plays a crucial role in assessing esophageal diverticula, especially for identifying smaller diverticula and evaluating associated findings. It is recommended when barium swallow or other imaging studies raise suspicion for a diverticulum. Endoscopy allows direct visualization of the diverticula and may be complemented by biopsies and brushings to evaluate for malignancy or infection. Various techniques, including flexible endoscopy and rigid esophagoscopy, can be employed based on the suspected size and location of the diverticulum. Manometric assessment plays a vital role in evaluating the motor function and coordination of the esophagus in patients with diverticula. It helps determine the underlying esophageal dysmotility, such as abnormal peristalsis, ineffective esophageal clearance, or impaired lower esophageal sphincter relaxation. Correlation between manometric findings and diverticulum formation aids in understanding the pathophysiology of esophageal diverticula and guides treatment decisions. For example, surgical intervention may be considered for patients with severe dysmotility contributing to diverticulum formation. Surgery for esophageal diverticula is considered when symptoms are severe or complications arise. Evaluation includes assessing diverticulum characteristics, associated motility disorders, and patient fitness. Different surgical approaches are used, with intraoperative focus on diverticulum removal/repair and addressing dysmotility. Close postoperative monitoring, pain management, and gradual reintroduction of oral intake are important. Functional assessment of esophageal diverticula involves esophageal emptying studies, which assess the clearance of swallowed material from the esophagus. These studies provide valuable information on the impact of diverticula on esophageal motility and swallowing function. Evaluation of dysmotility in relation to diverticulum presence assists in the correlation between symptoms and treatment strategies. Management options may involve lifestyle modifications, medication to improve swallowing, or surgical interventions targeting underlying motility disorders. Esophageal diverticula can have atypical presentations or mimic other esophageal conditions. Differential diagnosis should consider strictures, rings, webs, and gastroesophageal reflux disease, GERD, among other possibilities. Uncommon presentations, such as diverticula located in unusual locations, may pose diagnostic challenges and require a comprehensive evaluation utilizing multiple diagnostic modalities. Differentiation among these conditions is crucial for appropriate management decisions. Additional diagnostic tools, including high-resolution manometry, pH monitoring, and impedance testing, may aid in accurate diagnosis. This video covers the latest advancements in the management of esophageal diverticula. It explores endoscopic techniques, such as diverticulotomy, as less invasive alternatives to surgery. Novel techniques like peroral endoscopic myotomy, POEM, are investigated for motility disorder-associated diverticula. Advances in motility testing, such as high-resolution manometry and impedance planimetry, provide more detailed information on esophageal function. Ongoing research aims to better understand the physiology of esophageal diverticula, optimize treatment strategies, and improve patient outcomes. Collaboration among healthcare professionals is crucial for progress in this field. In conclusion, this video has covered important information about esophageal diverticula, including its causes, symptoms, diagnosis, and treatment options. This knowledge is essential for healthcare professionals to effectively manage patients with this condition and enhance their well-being.